Postnasal drip is something almost everyone deals with at some point, that annoying feeling of mucus pooling at the back of your throat, making you cough, clear your throat constantly, or feel like something's stuck. Our nasal glands are always producing mucus to keep tissues moist and trap dust and allergens. But when that mucus becomes too thick or too much, it starts dripping down the throat instead of draining normally. If this sounds familiar, stick around. We're breaking down the causes, signs, and how to actually fix it. Here's what's happening inside. Tiny glands lining your nasal passages constantly produce mucus. It's a normal, healthy process. This mucus moisturizes the tissue and traps particles like pollen and dust before they reach your lungs. The problem starts when these glands go into overdrive, producing mucus that's thicker or more abundant than usual. When mucus production ramps up, it leads to that constant sensation of discomfort and irritation at the back of your throat, the root of almost every postnasal drip symptom you'll experience. So how do you know if you're dealing with postnasal drip? The most common signs include a sore throat, frequent throat clearing, an ongoing cough, especially at night, and that tickling sensation deep in the back of your throat that just won't go away. In this video, we'll walk through everything step by step: what causes postnasal drip, how to recognize the symptoms, how doctors diagnose it, and most importantly, the treatments and remedies that actually work. Let's start with the most familiar triggers. Colds, the flu, and sinus infections are some of the most common reasons people experience postnasal drip. When your body is fighting off a virus or bacteria, mucus production naturally increases as part of the immune response. Allergies are another major culprit. Things like pollen, dust mites, and pet dander can trigger your nasal passages to ramp up mucus production as a defense mechanism, your body's way of trying to flush out the irritants. Sinusitis, whether it's a short-term flare-up or a long-lasting chronic issue, is another frequent contributor. Ongoing inflammation in the sinus cavities disrupts normal drainage, causing mucus to back up and trickle down the throat instead. Your environment plays a role too. Dry air, smoke, strong odors, and air pollution can all irritate the nasal lining, prompting it to produce more mucus as a protective response. Here's one that surprises a lot of people: acid reflux, also known as GERD. Stomach acid traveling back up can irritate the throat and nasal passages, triggering the same mucus overproduction response as other causes. Hormonal changes, like during pregnancy or while using certain contraceptives, can also affect nasal tissue and increase mucus production. And structural issues, such as a deviated septum or nasal polyps, can physically block normal mucus drainage, causing it to pool and drip backward instead. Overusing decongestant nasal sprays can actually backfire, causing a rebound effect that makes congestion worse. And for some people, certain foods, especially spicy dishes, can trigger excess mucus too. Now let's get into the symptoms in more detail. The hallmark sign is that constant feeling of mucus dripping or sitting at the back of your throat, often described as a tickle or a lump that won't go away. This leads to frequent throat clearing, or a cough that tends to get worse at night or when lying flat. All that constant irritation can also lead to a sore, scratchy throat, and in some cases, hoarseness or noticeable changes in your voice from the strain on your vocal cords. You might also notice nasal congestion, especially if allergies, a cold, or sinusitis is involved. Some people experience mild difficulty swallowing or nausea from mucus buildup, and because mucus can harbor bacteria, bad breath is also common. Sneezing, watery eyes, and sinus pressure often tag along too, particularly with allergies or infections. So how do doctors figure out what's causing it? It starts with a detailed conversation about your symptoms, medical history, the type of mucus you're experiencing, and any possible triggers like recent illness, allergies, or environmental exposure. Next comes a physical exam, checking the nasal passages and throat for signs of inflammation, mucus buildup, or anything unusual. If allergies are suspected, allergy testing might follow to pinpoint exact triggers. In cases involving chronic sinus issues or structural concerns, imaging like X-rays or CT scans may be needed to get a clearer picture. And if acid reflux is suspected as the underlying cause, a referral to a specialist for further evaluation might be the next step. Now for the part you've been waiting for: treatment. If allergies are behind your postnasal drip, antihistamines or nasal corticosteroid sprays can reduce inflammation and cut down mucus production, while simply avoiding known triggers helps prevent flare-ups in the first place. For postnasal drip caused by a cold or viral infection, staying hydrated, using over-the-counter decongestants, or saline sprays can help thin mucus and improve drainage. If it's a bacterial sinus infection, antibiotics might be necessary, though many cases improve with supportive care like steam inhalation or warm compresses. If acid reflux is driving your symptoms, managing it through dietary changes, antacids, or proton pump inhibitors is often the most effective approach to reducing postnasal drip long-term. For those in dry or polluted environments, using a humidifier and avoiding irritants like smoke and strong odors can make a big difference, keeping nasal passages moist and less reactive. When structural problems like a deviated septum or nasal polyps are the root cause, surgical correction may be necessary to restore proper drainage and airflow. One of the most effective at-home remedies is nasal irrigation using a saline solution, often with a neti pot or similar device, to flush out excess mucus directly. Combine that with staying well hydrated and cutting back on dairy or spicy foods, which can thicken mucus, for even better results. Postnasal drip can be frustrating, but the good news is that once you identify the underlying cause, it's almost always manageable. Whether it's allergies, an infection, acid reflux, or something structural, there's a path to relief, and if symptoms persist or worsen, checking in with a healthcare provider is always a smart move. Thanks for watching. If you found this helpful, give it a like, subscribe for more, and we'll see you in the next one. Remember, this video is for informational purposes only, and isn't a substitute for professional medical advice.